Thank you so much for joining us for our webinar today. Sorry for the couple of minute delay. Today we're going to be talking about tough topics on step one, and we'll go through a few practice questions as well. We'll be hoping for some audience participation, and we have polls set up. And then at the end, there are discount codes that you can get for tutoring with us as well if you would like. So don't miss out on those at the end. So just to introduce ourselves briefly, my name's Christina. I'm a neurology resident at Penn. I'm about to start my fellowship in epilepsy. And I've been tutoring with Elite Medical Prep for like almost 4 years, I think, 3 or 4 years. Yeah.
Hi, everyone. Thanks for coming. My name's Rebecca. I am just finishing medical school. I just graduated, and I'll be doing a TY internship and then doing dermatology residency starting next year. And I've been with Elite Medical Prep since January, so almost 6 months.
Amazing. All right. So just to go over what we do a little bit, since you're all with us today. So we really offer really customized tutoring for a variety of tests related to the process of becoming a doctor. So your step exams, COMLEX exams, shelf exams. We do a lot of residency advising, which can be really helpful since that process can be super daunting for folks. And we also do medical admissions advising and MCAT stuff as well. So you really have kind of the whole gamut available. And in addition to that, we have partnerships with a lot of different medical schools and are able to provide services to them as well. So what we're going to talk about today, we're going to kind of focus in on some problem areas for people. So we'll start with biostatistics. Biostatistics is not just important for step one, but also for step two, and even more important for step three. It does not cease to be important. It's also something that clinically is helpful to know. Then we'll go into some bioethics topics. Acid base, everyone's favorite, only second to biochemistry, which is also everyone's favorite. So we'll touch on some of these key topics, and please be sure to keep an eye out for our polls where you can participate and answer questions. In terms of our topics here, what I would say is that a lot of the questions that come up for step one in these areas are process specific. So for example, like acid base, there's a lot, often you have to remember like the Winters formula, which we'll go over today, and lots of different kind of flow charts. And they're really problems that get better, in my opinion, with practice. The more you do them, the better that you get. If you don't get enough practice, then they're a little bit more challenging to do. I also think for a lot of the ethical questions, they're quite involved, they're very detailed, etc. And so you can get kind of lost in the weeds and lose your 30,000-foot view of the question. And you're learning all of these things from UWorld, from AMBOSS, from these limited resources. And sometimes you don't learn them clinically in med school, on your wards. And so taking the time to review it here, I think will be really helpful to you all to kind of nail down some of these areas and potentially identify areas that you can work on in the future. In terms of how to approach these questions, I think that depending on the area, there's different resources that are really helpful. So for biostatistics, everybody loves the Randy Neal YouTube series. He breaks it down really simply. And importantly, really is only covering those high yield topics that you're going to need to know for your exams, not going into extensive detail about biostatistical concepts that are not relevant. First aid is also very helpful, and I can still remember in my head the mnemonics from first aid for type alpha and type beta error, accuse the wrong man, blindly let a man go free. These sorts of things really stick in your brain. So the folks at first aid have done a really good job of helping you kind of nail down some of these topics. And so you can see first aid is listed for almost everything. For bioethics, if you need additional help, you can also look at Medical Ethics for the Boards by Conrad Fisher. And when it comes to the biochem questions, what you'll really need to do, I also recommend first aid. There's going to be mnemonics that you can use to memorize things like glycogen storage disease, like Pompey trashes the pump, different things like this to help you kind of solidify these topics that are maybe not as intuitive or pathophysiologic. And for acid base, I honestly just recommend you do practice questions for those. Videos are helpful if the topic doesn't make sense to you, but in general, practice questions for everything and specifically for acid base, the more you do it, the better you will get. So let's start with a biostatistics question. So let me just pull up my poll here and hopefully we can get some participation. Can everyone see the poll okay? Okay.
Yes.
Great. So I will give it a couple minutes until I start to see some answers. They're anonymous. Don't be shy. I'll have no idea if you answered, but it's more fun if some of you chime in. So get in there. Tell me what you think. I only see a couple of you have participated. Give it a shot. This is the perfect place to get questions wrong because we'll go over them together and you'll be able to hopefully learn, okay? I'm gonna wait until I get one more and then we will, look at them streaming in. Thanks, guys. Excellent. Okay. Looks like people are putting a couple more in. Let me wait. Okay, that's pretty good. So let me end the poll. Can you all see the results? Yeah? Okay. So everyone, most popular answer here was 85%, but I also see some votes for 90 and for 2% as well. So the correct answer here is 85%. So let's go over this. So what this question is asking, basically they want to know what the specificity is, okay? So if we go to our table here, we know that specificity is the true negative rate. So going back to this slide, they give you a lot of words, but we know that we're interested in the true negative rate here. So we want to know how many false positives there are and how many true negatives there are in individuals without disease. So, it's not letting me go backwards. Okay, we'll try this. Okay. So if we look back at the original question, you can see that the test is positive in 15% of patients who do not have ovarian cancer. And so that means that 85% of patients who do not have ovarian cancer in real life are testing negative for the disease. So really this 85%, the other half of this 15%. So if we go to our table here, there's 15% of people without the disease who test positive and 85% of the people without the disease who test negative, the true negative rate, which is what we're also looking for in this answer, which is why the specificity here is 85%. Okay. See, someone raised their hand. Do you want to maybe type in the chat what your question is? Whoever has their hand raised that we can answer. Okay, well, while we wait for that to come up, we'll go on to the next question. And I'll go ahead and launch the poll again, okay? All right. People seeing the poll okay? Perfect. All right, let's get a few more answers in here. Great job, guys. Keep them coming. All right, good. We'll go ahead and take a look at the results. So most people picked randomized control trial and some people picked case control. So let's talk a little bit about study types in scientific research. So the best answer here was randomized controlled trial, and it's really because in the question STEM, they say that they are assigning people to these groups based on a coin toss. So the different groups that are being tested are randomized, right? Coin toss is 50-50 one, 50-50 the other. And so any study where you're randomizing people to an exposure versus a placebo or what have you, depending on what you're interested in, would be a randomized controlled trial. So they're looking at intervention versus control. They're randomly assigning, which allows for confounding variables to be evenly distributed, which is why it's the gold standard for any sort of study looking at efficacy of certain interventions over others. And then they look prospectively to the outcome of interest, okay? Case control study, which I believe is what other people chose, is when you start at the end with your outcome of interest. So for example, cancer, you may start at the end with people who have a certain type of cancer and people who don't. You divide them by that, and then you look back to see if a certain exposure is present, like an environmental exposure or something like that. And so that's what your case control study is. So you're not randomly picking those groups, you're picking the groups based on the outcome of interest, and then you're retrospectively looking to see if your diseased group had a higher exposure to certain things than your control. Okay, we'll go on to the next question. So shifting into a bioethics question. Okay. All right, I see some people starting to answer. Keep them coming in. Remember that answering the question one way or another is really going to be the best way you learn. So try and get something down on paper, commit, and then we'll go over it. I'll give it like 10 more seconds in case anyone else wants to get a last question answer in. Okay. All right, so the majority of people picked answer B, and then I think I had a couple of people for answer E. So B is the best answer here. And these are always kind of challenging questions, right? I think in general, when you're approaching these sorts of situations, you want to validate the patient, partner with the patient, and make sure they know that you're on their side. And if you have a deficiency, for example, here, that you're not familiar with a certain syndrome, allying with the patient, being honest about what you know and honest about what you don't know, because while this is a test question, in real life, this will happen to you too when you begin to practice medicine, and there will be times that you don't know the answer, and it's really important to be frank about that and to really tell the patient that you're going to learn as much as you can to try and help them at the end of the day. So both this question, I think, on a test and in real life, this is really the way you want to approach these sorts of situations. I think, commenting on somebody's prior workup that is rather extensive is generally not helpful. Also, passing judgment on a disease or invalidating somebody's diagnosis is also not helpful. And for people who have really had extensive testing like this, it's really often not appropriate to repeat that sort of extensive workup from a medical perspective. And so that's really why you want to go ahead, ally with the patient, tell them what you know, tell them what you don't know, and give a plan for where you're going to go moving forward. Okay.
All right, I think I will take it from here and do a few questions. And Christina, if you wouldn't mind helping me out with the polls, that would be wonderful. So we have another bioethics practice question here. So I'll give you all a second to read through that and then submit your answer choices. And Christina, whenever you see answers coming through, just let me know.
Yeah, so everyone's doing great. We've got a good amount of answers here. I've been giving it like a minute, so I'll give everybody about 10 more seconds to get their final answers in. Good job. I see them coming. And then I will end the poll in like a couple seconds.
Excellent.
Okay, perfect. All right. So there's those results.
Excellent. Excellent. So everyone did very well with this question. So the correct answer here is choice A, which most people picked, which is fantastic. I think the key to answering these types of ethics questions is that you want to remember that you always want to choose the answer that doesn't involve unnecessary or invasive imaging or testing or treatments. And you also want to always choose the answer choice that encourages communication between either patient and physician or patient and family. So if you notice, I think you can appreciate the subtle differences in these answer choices here, where answer choice A encourages more communication between patient and physician, where let's review ways or let's discuss ways that we can optimize your health, right? Versus we should do this is more definitive. You can do this is also more definitive, etc. So picking up on those subtle communication differences is important when you're counseling patients. So hopefully that makes sense to everyone, and let us know if you have any questions about that. Excellent. Okay, hopefully everyone's ready to switch gears a little bit into acid base. So this one's perhaps a little bit more involved. So we'll give you a minute to work through this one.
So far, just one answer. So I know you guys might have to do some working through some formulas and this and that here. So we'll give you some time, but eventually do encourage you to chime in when you're ready. I'll let you know when we get like we've been getting like a decent response. I'll let you know once we're there.
Excellent. Thank you so much.
All right, guys, don't be shy. I'll give you like 30 more seconds. I know this is a harder question, but please feel empowered to chime in and then we'll go over it. All right, I'll go ahead and wrap it up. Should
Okay.
have some results there.
All right, so it looks like we have a few votes for A. Some people were thinking about C, and some people were also thinking about D. So this is definitely more of a difficult question. And I think with these acid-base questions, it's important to have a stepwise approach that you sort of keep the same every time you see this type of question. So I'll kind of share what works for me when I approach these questions, which is when I see a pH value in the labs, I always kind of start there. So here I see a pH of 7.21. That's very acidotic, right? So I'm thinking there's some type of acidosis here, and that helps me narrow down some answer choices right away, okay? The next value that I like to look at is bicarb, and this is an excellent sort of scheme here that you can use to keep yourself organized when you approach these questions. And I sort of use the mnemonic where if the bicarb is changing in the same direction as the pH, I think of that M for same as metabolic. Okay, and so here, if we had a lower pH with a lower bicarb, and so they were changing in the same direction, so I knew we had a metabolic acidosis. But then you always have to check for compensation. Okay, and so the way that you do that is you look at the CO2 and use Winter's formula, which is one of the few formulas that you probably should commit to memory for these exams, which is 1.5 times bicarb plus 8 plus or minus 2. This gives you your predicted CO2 range if the lungs are compensating appropriately. Okay, so I pre-calculated for this question. I believe it's 21 to 25. The CO2 did not, in fact, fall in that range. So that, as a result, means we have a mixed respiratory acidosis and metabolic acidosis occurring together. Okay. A lot of students also ask about how quickly this compensation happens. And usually with respiratory compensation, it's minutes to hours. It's pretty quick for purposes of the NDME. For purposes of the NDME, metabolic compensation happens a bit later, hours to days, is what I usually tell students. So hopefully that makes sense. But I think a stepwise approach is very important for these questions. All right. And we'll do one more question here. So feel free to read through this one. Take a stab at it.
You all are doing great. Keep the answers coming.
Good work.
All right, I think answer, oops, some more people trickling in. All right.
Oh,
Just as
good.
I was about to call it. Don't be shy, guys. Don't let me thwart you. Get those last answers in. Okay, now it's slowing down. All right.
All right. Okay, so we have a mixed group of answers here. Some people like C, D, E, F, and G, which is tricky, right? These lysosomal and glycogen storage diseases are really confusing. So the correct answer here is Pompe's disease or type 2 glycogen storage disease. I think what's really helpful, there's a great table here that's included. Thanks for bringing that up, Christina. It's great to know the enzyme that's affected, but then what I also tell students is try to build the clinical scenario in your mind, right? So we know, for example, with Pompei's disease here, there's a problem with breaking down glycogen, right? Thinking very big picture. What are the organs that typically store glycogen? Well, muscle, liver, and also the heart is affected as well, right? And so when we're building the clinical scenario for this type of condition, we'd be thinking about a kid that's maybe having some muscular weakness, fatigue, right? Also has an enlarged liver, an enlarged heart from difficulty with breaking down glycogen stores. Okay, so it's good to learn the details and know the enzymes affected, but it's also good to apply that within the context of a clinical scenario that you can recognize when you're reading through these questions. Okay, so what would that look like for McArdle's disease, Fori's disease, et cetera? How do you differentiate them? That's when you know that you're really ready for these types of questions. So good work there. That was a tougher one.
I think we have a question in the chat, so we can take a moment to read that.
Okay. Yeah, so when you were tachypnic, blowing. So when you're tachypnic, I believe, so you're blowing off CO2, right? This is about the acid base. I figured without using Winter's formula, I could see if there's a metabolic acidosis from the bicarb, and then I could use PCO2 to see if it's acidotic or alkalotic, if that makes sense. Just seeing if my laziness could pay off. Yeah, it's a good thought. It's a good thought. So I think you're asking about if you can use the respiratory rate and also the CO2 level to determine if there's appropriate compensation, which probably, right, if you're trying to compensate and blowing off CO2, then the patient you would expect to be a little bit tachypnic. I just think it's less precise than calculating exactly what the expected CO2 should be, because there can be a lot of different mechanisms that might affect somebody's respiratory rate and CO2 levels. So I think if you can, it's always good to calculate what a fully compensated CO2 range would look like. Yeah, of course.
Yeah, I totally agree. And like specifically, they're probably going to give you a metabolic acidosis on the test because the Winters formula is like the formula they most expect you to know. And then even if you can say, oh, there's a metabolic acidosis, so they should be blowing off CO2, the question is like, how much CO2 should they be blowing off? And if they're not blowing off enough, then they're retaining excess CO2 beyond what they should be retaining in the setting of a metabolic acidosis. There's a secondary process, or that it's uncompensated. And sometimes the answer will be compensated versus uncompensated. So unfortunately, like I would have that formula down and I would apply it in these cases in like a formal way. Okay. Other
Right.
questions that you guys have going through these different types of practice questions, anything that came up? Okay. I'm not sure, how would you suggest integration when handling questions? Chandler, do you mind clarifying? I don't know, um, Rebecca, if you quite understand.
Yeah. What do you mean by integration? I think that would be helpful.
Hmm. Okay. Well, in the meantime, I guess we can look at the next question that we have. Oh, wait. Combining multiple topics together. that lead to an answer. Do you have a specific question that you're referring to? Okay. Yeah, I'm having a little trouble understanding that question. So I think any example would be helpful. They're saying looking at the big picture. You're saying how to look at the big picture instead of details. That I can answer. Yeah, I think that was really helpful. Thank you, Tommy. So typically what like, at least what I recommend my students, and Rebecca, you can also chime in, is that I usually will recommend folks when they're reading the question stem, and this is a practice, right? You're going to practice this as you do your UWorld and prepare for your test. But when you read through the stem, try and focus on the three most important pieces of information that you deem important from the stem. Because you're right, you don't want to get caught in the details or get hung up on a certain value. I see a lot of students get hung up on something they don't know. They're like, oh my God, I don't remember what rouleau cells are. And it's like, you don't need to know what rouleau cells are to answer the question. You need to look at the big picture. So pick the things that you think are the three most important. Patient comes in, they're hypotensive, their hemoglobin's 6, and they have gastric pain. And those are the three most important things. And you put those three together and you think maybe this person could be in hemorrhagic shock from a gastric ulcer, for example. So try and practice extracting what you think are the three most important details, and over time you'll get better. And also in real life, that is what you do in medicine. You get a patient in front of you who tells you a bunch of information, much of it, most of it is not relevant. And it's your job to actually sort through that information and figure out what's relevant. And so you're going to practice that on your test. And then hopefully one day you can do it with patients too.
Yeah, I totally agree. And I might just add that nowadays the NBME is purposely writing what I call imperfect questions. You may notice that where they'll kind of throw in a detail that maybe doesn't fit with the bulk of the question. And because medical students are so type A, so detail oriented, they pick an answer choice based on the detail versus the bulk of the question. You have to pick an answer choice based on the bulk of the question. If you're too detail oriented, then you'll be punished by the NBME. Okay. I think that's what trips up a lot of students.
Okay. I see YouTube videos.
Okay.
For the Randy Neal, yeah, I mean, I think you can pick the ones that are most helpful. I love that you guys are already crowdsourcing videos. That's excellent. But yes, it's whatever topics that you struggle with. For biostats in general, you're gonna have to memorize a bunch of formulas like sensitivity, specificity, true positive, or like number needed to treat, all of these sorts of things. And if you just like, what I always recommend people do is the week before kind of practice writing all of them down so that you have them memorized, and then go through the videos so that you also understand them, so that you know how to apply them appropriately. Because sometimes if you just like memorize the table, if you write the table wrong, then you will misrepresent the formula. So in addition to like knowing the formulas, you also do need to kind of understand them. Okay.
Speaking of biostats, I think Taylor wanted to know about relative risk reduction, which there's absolute risk reduction, which is just the difference between the risks in the two groups. So that's a subtraction problem, right? And then relative risk reduction. And I think of that as the proportion of risk reduction in the experimental group compared to the control group. So it would be the control group risk or event rate minus the experimental group event rate divided by the control group event rate. And that would give you the relative reduction between the two groups.
I heard the test has really long questions. I lost it. Oh yes, with patient HPIs, any tips on finding more practice questions like these besides the free 120? I think that UWorld and Amboss also have very long wordy questions, and I think that Step also will give you long wordy questions. I don't really think that you need to go. I think everyone should always do the free 120 because there are questions from the free 120 that will show up on the test. It can like occasionally happen, so it's just like free answers. And it's good practice, but I think that honestly, like all the test taking software, all of those questions are also rather wordy and long. And there's going to be a lot of like filler in there that you'll have to go through. So I think just doing your UWorld and Amboss will get you there.
In terms of resources besides UWorld and first aid, any other material that's important, um, I think you should choose sort of maybe 2 to 3 third-party resources you love and just kind of stick to those. For me, I love the Boards and Beyond videos. Those were great when I was studying, just to kind of tie up loose ends for topics that I wanted to review. And then also don't forget about the NBME practice exams. You should be doing all of those. I think there's like 6 of them now for step 1. So do all of those. You'd be surprised how many similar questions come up on the real exam.
Yes, I totally agree. I love Pathoma also and Sketchy also. I really like Pathoma. I think it's really, really good for there's like I still know the coagulation cascade from how I learned it in Pathoma. So and it's been years now. Um, which Q bank is better, Amboss or UWorld? I don't know. I don't think that I can pick sides. Um, they both have their you I would like the way I think about it is UWorld has a bit more data behind it. There's just like more time that it's been out there than Amboss is a bit newer. I think that so UWorld like it's not that Amboss is bad, it's just that I like have a lot more experience with UWorld. But Amboss, I think that the explanations and like the resources for going over things is much more comprehensive. Like Amboss, you can use as a primary source more, whereas UWorld is more of a question bank with explanations. So I often will go to Amboss during sessions if we want to get into the nitty-gritty about the pathophys of a certain topic, whereas UWorld, I really have people doing that Q bank to get used to their testing and also so that you can have a metric for how you're doing before you take the test. Um, okay, there's a question about 5-alpha reductase deficiency. Um, I think that that might be a little bit getting into the nitty-gritty um, off the top of my head. I don't know, Rebecca, if you want to comment on that at
Yeah,
all.
I'm so it's a whole topic that you could dive into, but basically you need a 5-alpha reductase to form external male genitalia. If you don't have 5-alpha reductase, you will have ambiguous or underdeveloped external male genitalia. That's what you'll see in the question.
Um, in terms of this question about vasculitides, the way that I think about vasculitides I mean, man, all of these I feel like in and of themselves could be entire topics, but I think there's two things. So the vasculitides, there's like small, medium, and large vessel, which is how I think about them. And it literally just means like how big is the vessel that is involved in the vasculitis. So to step back, like vasculitis is inflammation of the vessel wall. So, like the blood vessels in your body are inflamed, vasculitis. In terms of like the way to think about them, I like to think of small, medium, and large, and then I like to think of like ANCA associated and not ANCA associated, and that's most of what you need to know. So like the large vessel vasculitides will be like Takayasu and giant cell. And really, like for each vasculitis, this test only wants you to know like two things. So for giant cell arteritis, it usually affects the like superficial temporal artery. You get headaches, you can get amaurosis. You have to give steroids to folks if they have vision loss with that. Otherwise, they can go blind. And you give steroids before biopsy, which is a common test question. Takayasu is like an aortic arteritis. So they'll have like issues with their pulses because of the branches coming off the aorta. And beyond that, there isn't that much that I would know about it. Your medium vessel vasculitides, Kawasaki, this is the common thing that occurs in kids with the strawberry tongue, the fevers, and the rashes. And then polyarteritis nodosa, they don't talk as much about this one, but you can get these kind of like erythema nodosum on your skin in addition to the vasculitides. And then there are the small vessel vasculitides. So I think of like MPA, microscopic polyangiitis, eosinophilic granulomatosis with polyangiitis. And essentially, like most of these vasculitides are similar with like a single clinical feature that differs. So for example, in your granulomatosis with polyangiitis, it typically affects like the nose, lungs, and kidneys. And it is often associated with like a C ANCA, which is why you can like draw a C on your body to remember it. And the other vasculitides will vary slightly in terms of like the involvement of nasal polyps and things like that. So I typically like think of them as small, medium, and large. And then I would remember like the key clinical features for each one. So like what vessel is affected, like superficial temporal, aortic, renal, pulmonary, nasal, etc. That was a lot about vasculitis, but hopefully helpful. Okay, I don't think that last thing is just a comment. And then the other thing I'll say is that for coming to this webinar, you do get a discount. So if you want to register, feel free to use this coupon code here as well. Any other questions that folks want to throw into the chat? Oh, I see. Okay.
Yeah, at what point do you guys recommend slowing down on UWorld, doing more content-based things like reading first aid, YouTube videos, pathoma? Um, I think there are different study strategies that can work for different people. What I tend to recommend is, for me, first aid felt like more of a comprehensive review. It had almost every sort of diagnosis that you needed to know for the exam, but not to the level of detail that they expected you to know it. So for me, first aid was the last resource I used before I took step one as sort of an overall review at the end of all my deep dives that I did earlier. I think doing the YouTube videos in Pathoma can be helpful along the way while you're doing UWorlds because it's helping you to learn these topics that you need to review again. But I think as you get closer to test day, what I would recommend is really knowing the NDME questions very well. So making sure that you know all your practice exams as well as the other answer choices that were incorrect and how they might present in a question and the free 120. So that's just sort of the approach that I use, but maybe Christina, you have other suggestions.
Yeah, I think that I totally agree. It really depends on your study style. I think from like my perspective, I liked doing upfront reading the first aid as I was doing the UWorld. And that was kind of my general overview. So reading first aid in the morning, taking notes, kind of really getting in the nitty-gritty. And then in the afternoon, I would do questions, pathoma, sketchy, all of that stuff. I think that like reading first aid is a non-negotiable for this test. It is a fantastic resource. And frankly, sometimes I still go back to it, even though I'm not studying for any tests like this anymore, because it is just like really simple and logically laid out. So it really depends. You have an earlier method, a later method. It's kind of like what works for you. As long as you get through it, I think that's the most important thing. Is UWorld still enough for step one? I think so. I didn't think that this was controversial. But yes, it is. I mean, it's extremely comprehensive. It will have thousands of questions. It's obviously you can't use it in isolation, right? So you should use your other resources, your first aid, your Pathomo, whatever supplementary source that you prefer. I don't think that it's the only thing that you can use, but it is certainly very comprehensive, and it simulates the exam quite well.
Mhm. Is doing Anki essential? I heard so much, but it's so hard for me. Yes. Um, so I think the bottom line is you need to be doing spaced repetition. Okay. Anki is like a really straightforward and simple tool for spaced repetition. I can't tell you how many students I've worked with who say, well, I learned it really. I totally understand this. I'm never going to forget this. But information is coming at you so fast in medical school that if you're not implementing spaced repetition, you will forget it eventually, right? You have to keep coming back and integrating this material. So Anki is a great method for spaced repetition, but if you have a different method that works for you, that's fine too, as long as you're coming back and revisiting these topics, because it's all about integrating at the end. That's sort of what they want to get you to do.
Yeah, I totally agree. You have to have active recall somehow, and you have to come back to old topics. And Anki is just the only tool I know of that's free that does that. But as soon as there's another one, we can move along. But alas, I am an
Yep,
Anki stan. I too recommend it to everybody. And
I
in
am too.
fact, I just took my in-service exam and I used Anki to study for it. So let it be known, I practice what I preach.
Yep.
Any other questions, guys, gals, all? No problem. We're happy to help.
Of course. Thanks for coming.
Yeah, thank you guys for coming. Thanks for participating in our polls. I love participation. Okay, someone raised their
Mhm.
hand. So I would just type in the chat what your question is. All right, well, that seems to be it. So thank you all again. Take care and feel free to reach out to any of us if you have questions, okay?
Of course. Thanks, everyone. Take care.